at that body. Girl, look at that body. I work out.
Oh my gosh. That guy is so good looking. I think my heart just skipped a beat.
You say your heart skipped a beat? My heart does that and I have to take a drug for it.
Okay. What do you take?
Well, I don't know. Let me call my son. He's a pharmacist and he knows all about that sort of thing.
Okay.
Hey, son. I got this pretty little thing over here. He wants to know a little bit about that drug that y'all got me on.
What, Dad? Your lisinopril?
No?
You mean your Viagra?
No, son. That gummit, my heart pill. It's the white one. It's got some numbers and some letters, and I take it twice today.
Oh, you mean your Flecainide?
Yeah, that's it. Why don't you show off all that education I paid for, son, and tell us a little bit about it.
Okay, Dad. Well, it's generic for Tamacor. You're using it for atrial fibrillation, but it can also be used for atrial flutter, supraventricular tachycardia, and cardiac dysrhythmias.
Wasn't there some bad stuff you told me it did too?
Well, yeah, it can cause some heart palpitations, nausea, dizziness, headache, a little blurred vision and fatigue. It's got some serious complications of cardiac arrest, dysrhythmias, heart block, heart failure, and it can even prolong the QT interval.
Don't it have something to do with salt? You and them doctors keep trying to tell me to cut back on it.
Well, it's a class 1C antiarrhythmic, also known as a sodium channel blocker. Not exactly the same thing, but you know, Dad, you really should cut down your salt intake. I've really been talking to you about that lately.
Yeah, y'all keep trying to tell me that, but with your mama's cooking, it's real hard. Speaking of, ever since you got that fancy job, you ain't never come see us. Your mom's always complaining about it, and I gotta put up with it. When are you gonna come visit?
Yeah, I know, Dad, but just been really busy lately. Actually, I got a patient here right now, so I'm gonna have to let you go. Why don't you call Jonathan about that? He knows a lot about that stuff. All right, I'll see you later. Sorry about that. Put the coat on, huh? Yeah, I can't feel this.
I guess maybe I lost connection with him, but I got another son I can call him. He's got a little more respect for his elders. He met his mama in the war.
Is that
He's
so?
real smart. He runs a drug lab. Let me give him a call.
A drug lab?
Yeah, he's like a scientist.
Okay.
Hey Dad, what's up? You want to know more about Flecainide? Okay, I think I got some research on it. Flecainide is classified as a class 1C antiarrhythmic and one of the sodium channel blockers. It works by slowing the upstroke or production of the cardiac action potential, and it prefers open channels rather than inactivated channels. It's also considered one of the most potent antiarrhythmic agents since it dissociates very slowly from the channel, and this can cause a marked depressive effect on cardiac function. It has a minor effect on the QT interval, but a prolonged effect on QRS. Doses range from 50 milligrams BID to 400 milligrams a day, depending on the indication, of course. It peaks about 1.5 hours to 3 hours and is active in its parent form. However, it's also extensively metabolized by CYP2D6 with an active metabolite, meta-O dealkylated flecainide. It has a half-life of about 7 to 22 hours, and 80 to 90% of it is eliminated in the urine with about 10 to 50% unchanged. So it has to be adjusted for renal impairment. I can send you more notes if you want.
Oh my gosh! Holy cow!
Yeah, well, thanks, son. I think we got your research. I'll talk to you later.
All right, see you, Dad. Learn something new every day.
Okay, well there's no way I'm going to be able to figure all this out, and thanks for your help and the advice, but I'm going to call my friend Tiffany and see what she thinks. She's a pharmacist.
You're welcome anytime, sweetheart.
Hey Tiff, hey, can we meet up for coffee pretty quickly? I need to discuss some things with you. Okay, thanks, bye. Hey, thanks so much for meeting me here. So this creepy old guy in the park told me I need to take Flecainide and called his sons, and it made me so confusing. What do I need to know about it?
Well, first of all, when you begin taking this drug, you need to avoid any activities that require a lot of coordination.
Oh, it's okay. I can't dance.
Well, no, silly, not things like that. I mean things that can be dangerous, like driving.
Oh.
And are you still doing that weird vegan diet?
No, just vegetarian. I like my milk and eggs.
Okay, well, vegetarian diet can actually increase your risk of side effects with this drug.
Oh, well, what if I become pregnant?
It's not recommended that you use this drug during pregnancy or lactation. What makes you even think that you have an arrhythmia?
I was just saying how hot this guy was that he gave me made my heart skip a beat, and the old guy just said I need Flecainide, so I don't know.
Well, this would not be the drug for you. It has what we call black box warning, which states that this drug should only be used for patients with severe or life-threatening heart arrhythmias due to its potential to cause, deadly side effects. So.
Oh, okay. Well, thank you so much for your help.
You kids stay off my lawn. Stay out of that fountain.